Transportation is another topic that is so broad for our people that, you know, you're thinking about a person that has a dialysis patient, and that patient has to go from Fort Peck, Montana to Billings, Montana for care. That's 4 hours of a drive that someone has to take. Maybe they have transportation, maybe they have the resources to do it, or maybe they don't. So as healthcare practitioners, we need to understand that. So we don't just issue a referral and assume that, everything's going to magically happen after that. So understanding that broader need of health.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Think of a mother living in a remote village in Alaska. It's a cold morning, temperatures well below freezing, and she needs urgent medical care for her child. But there's no road connecting her village to any hospital. Her only hope is a plane or a boat, neither of which might arrive in time. Across America, thousands of Native Americans face similar hurdles every day. Lack of access to basic healthcare, clean water, and nutrition. This is not a challenge of the distant past. It's happening today in the wealthiest country in the world. I first met Roselyn Tso at last year's Rosenman Symposium, where her talk left a profound impression on me. Her insights into the healthcare barriers that tribal communities face struck a deep chord, highlighting an urgent issue that many of us rarely think about. Stepping forward to tackle these issues head-on is Roselyn, a proud Navajo Nation citizen who has dedicated her life to improving healthcare for American Indians and Alaska Natives. As director of the Indian Health Service from 2022 to 2025, Roselyn managed healthcare delivery to approximately 2.8 million individuals, becoming the first Navajo citizen and second woman to ever hold this role. Her career spans more than 4 decades, each day driven by a deep personal commitment shaped by her own upbringing on the Navajo reservation. Roselyn believes real solutions require more than just medicine. They demand community engagement, cultural sensitivity, and innovation. Under her leadership, Indian Health Service championed initiatives addressing food insecurity, transportation challenges, and infrastructure gaps, fundamentally reshaping what healthcare means in tribal communities. In our conversation, Roselyn shares her powerful personal journey, the reality faced by Native communities, and her visionary approach to leadership and collaboration. She offers compelling insights into the systemic changes needed to make healthcare truly equitable and effective. Here's our conversation. Well, welcome, Roselyn. Thanks for joining us today.
Thank you. Good morning or good afternoon, depending on where you are.
We've been trying to get you on our podcast. Finally, with all the schedule, I'm so excited to have you. And it was great to meet you. Was it last year? Yeah, it was last year when we first met. And I learned so much about the work that you do. And I'd like to share that with many of our listeners. I always like to start with sharing your personal journey, the path that you took that take you where you are today.
Yeah, thank you. Thank you so much again. So, gosh, it's a heavy question for Friday, but that's okay. I grew up on the Navajo Reservation. The Navajo Reservation is the largest land-based tribe, and the Indian Health Service works with more than 574 federally recognized tribes. And so, growing up on the Navajo Reservation was certainly my foundation, my experience with respect to whether it was education, community involvement, and the like, and sort of what formed, as I reflect now, particularly in this last few days of my assignment here, I think about that a lot. I think about that, and throughout my 28 months with the Indian Health Service as the IHS director, you really have to have a solid foundation, something you can go back to, something you can get to, because it's not the easiest job, of course, and in the role that I've been in. That being said, though, I would say that that upbringing, that foundation that my parents provided for me. My father was a Korean War veteran. My mom was she stood side by side with my dad, but also was a stay at home mom for a majority of my growing up. And then on the reservation, of course, you have to go to the local whatever school is available. Fortunately, we were not that far from the local school, so that was sort of the foundation. And then from there, I took other steps to advance my education. That was a critical component. Somewhere along after high school and a little bit of college, I found the Indian Health Service, or actually the federal government. Started working there for a bit, and then found the Indian Health Service around 1983, and then worked out in all different kinds of positions that I've had with the federal government. I have currently more than 4 decades of service with the Indian Health Service. That has been, I would say, one of the um, best things that I've brought to the Indian Health Service, I believe, understanding the IHS from within. There's at least 3 levels of the Indian Health Service. One is, of course, is the on the ground level where healthcare services are being provided, and then there's sort of this medium level or second level, which is a regional, how the Indian Health Service operates, and we have 12 regions across the country. And then there's the IHS headquarters where I am at today. Our headquarters is in Rockville. We have a workforce of about 15,000 employees. Throughout my career, I have had wonderful, supportive supervisors. I realize not everybody can say that all the time, but I've had people that have mentored me, whether they were my direct supervisors, tribal leaders, community leaders, that I was able to engage in. And I'm thinking today of how powerful that was, how important that was for me to have that added to my foundation of a young person growing up on the reservation. So taking all of this now, and of course during this time as a young mom, went back to school, understanding again part of the mentoring that I received. I remember a supervisor telling me at one point, you need to get those initials behind your name, how important it is to advance your education, to always be in that learning mode. And that's something that I have brought with me, not just personally exercising that, whether it's today reading a book of what's happening today, because we know that there's so much happening around us every single day. So that really was taking all of that now, and then sort of this capstone is the best word that I can think of now, having now been the area director, or excuse me, the Indian Health Service director for 28 months during this administration, has just been amazing. It is something that I will cherish forever. It's an incredibly humbling experience, and everything that I believe that my parents started way back when, or my grandparents for that matter, and my aunts and my uncles, how important that was to prepare me for this role today. And so that's really that. Then taking all of that and being able to impact the lives of the people that we serve. 2.8 million people rely on the Indian Health Service healthcare system. And the healthcare system is huge in that it's not just the government, it's tribes, tribal communities, and urban healthcare facilities. And many of those, more than 60% of the healthcare system that was traditionally provided by the federal government are now in the hands of tribes, tribal leaders, and tribal communities. And what a more powerful way to look at that over the past 24 months, 28 months, to really appreciate that particularly in health. You can't fix health from here, from Washington, D.C. or Rockville, Maryland. You can't. These are programs that are best run by local tribal leaders that know what's best for their tribal communities. Because one of the misconceptions I believe is that, well, if you're Native American, then you all kind of have the same challenges, or all have the same issues, or all have the same, whatever. That's not true. As I've traveled throughout Indian country, realizing this huge, diverse country that we live in, and even more so in tribal communities, our customs are different, our traditions are different, our language is different, our all of that, our food, the foods that we eat are very different. And so bringing that to the organization and bringing that to my role as the leader and learning that, actually really learning that by being on the ground and visiting with tribal leaders, has been one of the things that I would say that I learned the most. The
Mhm.
second thing that I would say I learned the most is that, we in the healthcare system, of course, we're always looking at just the doctor visit, the exchange between the doctor and the patient, or the pharmacy visit, or the whatever that healthcare visit is. It is way more than that. When I visited tribal communities and understand and appreciating social drivers of health, we talk about that all the time now. What are those impacts? But for our people, it's so real. We talk
Mhm.
about food insecurity across Indian country. Um, and then on top of the food insecurity is that we're no longer, many of our tribes are going back to traditional foods because we know now that they were healthier and better for us.
Right.
Transportation is another topic that is so broad for our people that, you know you're thinking about a person that has a dialysis patient, and that patient has to go from Fort Peck, Montana, to Billings, Montana, for care. That's 4 hours of a drive that someone has to take. Maybe they have transportation, maybe they have the resources to do it, or maybe they don't. So as healthcare practitioners, we need to understand that. So we don't
Mhm.
just issue a referral and assume that, everything's going to magically happen after that. So understanding that broader need of health. And so that takes us back to the core of the Indian Health Service, which is our mission statement. And
Yeah.
if you go to our mission statement, and it talks about how we need to make sure that the Indian Health Service mission is to improve the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. That's it. That has been my greatest that's what I say is the capstone of my journey over the past 28 months.
That's great. I think listening to you, what you mentioned about the importance of mentorship, and I'm hoping that every one of us can be a good mentor to anybody. And I think this I always think the secret of being a good mentor is to care for other people. And I think when you care, then and also not everybody is lucky to find a good mentor. And some I think it's also a skill set for you to find a good mentor. And if only maybe you said that you've been so lucky with finding a mentor, good mentors, good supervisor. Do you think it's by luck that everybody in the Indian Health Service have that kind of profile, or is it because you know how to seek the right mentors?
I think that as I've been on this journey, it is never by luck. It's never, because it's a two-way. Everything we do is at least a two-way street between whoever you are working with. So one of the things that I think that worked really well for me was, that engagement. And even I ask for it. I always like, what do you think about this? How do you, how did things work? I'm a reflective person in general, so I like to look back and say that this decision worked well, that this plan worked well. Because what I think we get into sometimes is that we create a path, and then there's no off ramp. There's always an off ramp. There's always a way to tweak or to adjust that plan at any point in that process. And that doesn't mean failing. That just means we recognize certain things along the way, and we get to make that change. So I've had people that have allowed me to make mistakes. I had people that allowed me to create off ramps. I've had people that, or I did it, that was part of, I just did it. And I think that that's sometimes a missed opportunity there when we talk with someone, when we do things that we just assume that, I have to change. So I must have made a mistake somewhere along the way. It's not that at all. It really is about also trusting in yourself that it's okay to make mistakes. It's okay to adjust where we need to adjust. There's nothing wrong with that. So I see that as a two-way street. And what I've done at the Indian Health Service in the 28 months to build that mentorship across the leadership team. And I think that's another sort of, especially in the federal government, you have supervisors, you have managers, and then you have leaders. And the leaders need to be in a place where they can lead. So you have, and sometimes we get into managing versus leading at this level of an organization. So staying focused on how do we want to lead, and what that requires is I have to be able to be strategic about what I do, and I have to be mindful about what I am doing and how I am doing that. So bringing that to an organization over the past 28 months I think has been amazing because we've created now opportunities to bring that mentorship into the senior staff level. We brought in coaches for the senior staff level because you always need a coach. You not all of us know everything and should we know everything? You don't have to. But how do we strengthen and how do we provide that that opportunity for our leaders to have what they need? So my focus during the 28 months has been leadership at the level to lead a healthcare organization. And it's even more critical in healthcare because we know that healthcare is changing as we speak. It's changing. We learn new things. We're doing new things are developing. So how do we stay in front of that or at least stay involved to understand what to look for?
Yeah, it's interesting when we reached out to you last year, many folks will share to us like, you guys should reach out to Indian Health Service. You got a lot of things done right. And I think there's a lot of respect of what you've done. And, majority of the people probably, they're not part of the Indian Health Service. I think you touch on a little bit about the role of the Indian Health Service. Maybe you can speak a little bit more about what are the role, like why it's important to have in the service for the Indian Health Service for the tribal community, and what's the impact that you guys do to serve that community.
Yeah, thank you. So I would say, again, this has really been IHS is not new. We've been established for many years now, but our role continues to evolve. For one of the things that I've also cherish. And even though I knew this as I was growing up and I understood, is that the relationship between the federal government and American Indian federally recognized tribes is so critical that there were treaties that were signed, there were executive orders, there were legal decisions that have been in place over the years where for the exchange of land or resources in Indian country, the government provides healthcare services to Native Americans and Alaska Natives. And that's the fundamental, that's the responsibility of the federal government, that there were agreements that were in place in exchange for resources across Indian country where the services are provided through the Indian Health Service. That has since evolved, as I talked about, through the Indian self-determination now where tribes can take those resources that were utilized by the federal government and now be utilized. Now the tribes, they are in the hands of the tribes. So they decide what kind of healthcare systems that should be provided for. So they've stepped into the shoes of the Indian Health Service, if you will, to provide care for their own people. And what amazing, amazing story there, because, if you go out to Oklahoma, there's the first time where we have a medical school on tribal land. And so how critical that is. We need a medical school on we want a medical school on every tribal land. We know places where there's a first time we have cancer centers and tribal communities and tribal land and how important that is. And we need more of those. So those that fundamental the government to government relationships that tribes have with the government, our role is that health arm. And so that is the fundamental foundation of why the Indian Health Service exists and how it is that now we work with tribes. When I came in, I think one of the things, well, not I think, but one of the two priorities that I set from the beginning was one is to ensure that we protect our partnerships and our relationships with tribes and urban programs because we as a federal government cannot do that alone. That partnership is absolutely critical. So we speak with one voice, if you will, or make our voice stronger when we speak, asking for the same things, whether it's going to Congress, whether it's asking for more resources, or whatever that might be. How important that is. And then the other one was to ensure safe and quality care. And when you do safe and quality care within the government or within Indian Health Service, it's challenging because we don't have all of first of all, we need to quantify that or qualify that. How do we know when we have reached that goal that we're providing safe and quality care? And so part of what I have done over the 28 months is really bring the agency together. As I said earlier, we have 12 regions and I worked in those regions before. And so we're spread out so far. But when we can build economies of scale and efficiencies by bringing a healthcare system together. That doesn't mean it's a cookie cutter and everybody's going to act the same. That just means that we're pooling the resources that we have to help us be as efficient as we possibly can, whether it's in the recruitment space or hiring space or purchasing space or even clinical policy space. All of that is coming under one umbrella now, as it should. Because again, IHS will continue to grow smaller as more and more tribes take their programs. So the more efficient we are, the better we're going to be in terms of providing and ensuring that quality and safe care. Of course, there's way more metrics than that have to be used. The last thing I would say on that point is that the data is what drives efficiencies. We have to have systems and using technology, using every technology available to us to drive those efficiencies. And so that has been something else that we have built over the years where now I get weekly reports that I can scan the entire agency. I
Mhm.
can scan and we should be making decisions based on that type of data where we can. So those are just a few things of one, just just making sure that the services that we provide, that we're accountable to the people that we serve.
You mentioned earlier today about the community that you serve are very diverse and the culture is different, the food they're eating. Like, um, give us a little more insight for people who are not familiar. Like, when you say different, like, how different is it?
So I can give you, I think the easiest way for me to explain some of the differences is that, for example, when you think about Alaska, the big state of Alaska, and you think it and you take it down and you think, how is healthcare provided in Alaska when you have no roads in Alaska? People, if you want to get to a village, it's either by air or by boat and think about that for a little bit more and how challenging that could be. So when you bring in the health component on top of that, you're trying to navigate how do you get a patient from point A to point B? Let's say the weather's not going to permit you to fly. So what do you have to do? We have to adjust for that. We have to find another way to provide that care to that patient. So in Alaska, again, one of the things that I leave with is just of course, I can't fix the road situation and I can't fix the transportation situation, but we can support and we can understand the true challenges that they have. So they've created systems up there to best meet that. And one of those programs is called a CHAP program, the Community Health Aid Program, where a community member is trained extensively to be a community health aide. So you can imagine if there's an emergency in that community. And remember, some of these villages are 300 to 500 people, so they're small villages. And so that community health aide becomes the extension of a provider that maybe is one of the larger communities, like Anchorage, for example. So they're the eyes and ears and the hands of the provider through telehealth or through telemedicine. So those are the programs that have to, and that program has been in place for more than 50 years. Amazing, amazing program. But you have to think about that in that setting. My other thing I would say about my travels to Alaska is that we don't understand that in one of the villages that I visited most recently, I like to kind of see how do the people live wherever I travel. What are the homes like? Where do they live? Again, because we don't all have the same kinds of homes and so forth. Um, and so I recognize that. And I always want to go to the store. What's in the store? What do things cost? And the last place that I went to, a gallon of water in Alaska in this community that I was in was over $14. A gallon of water was over $14. A can of soda or a can soft drink, a sweet and that has sweeteners in it or whatever, was $1.20. So if people can't afford water, I mean, just think about that. And then but they can afford maybe a can of soda. The challenge that brings is that when the children are then school age, you're talking about reconstructive dental work that might be required for that. So understanding and appreciating that one of the other things that the Indian Health Service does is water and sewer infrastructure under the public health umbrella. So you think that it's not just healthcare that we do. We do a lot more than that. We work in many different areas of a rural healthcare system. But here again, in Alaska, you can't just dig a trench and put the water line in and or the pipes and so forth. In Alaska, it's above ground because again, the temperatures and those kinds of things that you have to adjust for. So to understand that is to be there with them in that community. Then you go to the lower 48 and where you look at these large land-based tribes and where I remember getting a text message and saying that USDA hasn't been delivering our food boxes to people. And, I could just say, well, USDA is not under my sorry. No, we raised that issue. And what happened is that there's this, again, misconception that, well, the food boxes that maybe USDA provides are food boxes that are just supplement foods for people. Well, that's a huge assumption to make, I think, when that may be the only source of food that a tribal community member has. So to not make it available or to miss a distribution or to deal with whatever issue that might have been, we're impacting that family. And then you take it a step further, again, tying it back to health. If I'm a young mom that I'm relying on that food box and I'm trying to, I have a sick child, which one are you going to deal with? You're going to deal with try to resolve the food issue or the medical issue. Generally, the medical is going to move to the bottom of the list because you have all of these other critical elements that need to be addressed first. So in that particular case, I think and this is not just in Indian country, this is across the country that we're making broad assumptions that well, it's just this or it's just that, or they should just do this or they should just do that. I think as we continue to move forward and embracing how we look at uh, our people, the people that we're trying to serve, again, in any healthcare system, and not taking into consideration these social drivers of health, are, it is when we're only addressing then one part of the person.
Yeah.
So I can go on and on with examples. As I said, with transportation, I mean, it's heartbreaking when we just, make these
Mm,
assumptions that a dialysis patient that I raised earlier, that,
right.
and they have to leave probably before the sun comes up, and they're probably waiting all day somewhere for that dialysis treatment. And if you've ever gone through that or seen anybody go through dialysis treatment, the last thing you want to do is be on the road for 4 hours.
And you have to do it multiple times in a week.
And you have to do it multiple times. So, how do we look at this different? And I think one of the things I would say is that as healthcare practitioners and professionals and leaders of a healthcare system, you can't possibly understand this sitting here in Washington, D.C. or Rockville, Maryland. You cannot do that. Going and sitting side by side with tribal community members, tribal leaders, and hearing their challenges,
Mhm.
and then come together on solutions is one of the things that I hope that I have laid a foundation for during the past 28 months.
Yeah. I think, being living in the urban and when we first met thinking about, there's no access to clean water. That's why people have to buy the $14 a gallon water. It surprised me because I think like this is the United States of America.
Right.
And I think sometimes that's why I think I really appreciate you sharing with that because not everybody have the opportunity to visit different villages and to kind of look at it differently about how. And you mentioned earlier about also going back to more traditional food, the food insecurity, and also the USDA the foods program there. It tend to be. I wonder if it's less healthy because the choice is Coca-Cola $1.25, $14 for a gallon of water. Everybody will buy for the Coca-Cola. And I wonder, is that the same also with the food?
I had a chance to visit a food distribution center, and I visited several actually, and the ones where the tribes are taking the lead on, they have made choices to also add healthier foods, more vegetables, more fruits, and more fresh meat that they put in those boxes. That's not the way they come from USDA. So I think as we move forward and really talk about what is best for these tribal communities, they have to be listening and working with those tribal communities of how and what kinds of foods to bring in that work better. One of the boxes that I saw, it had this um, big box of cereal, and that I remember, and I kind of took issue with that. Like, is this really the best thing that we want our little children to be eating? And then there was a bag of rice there. And I thought, gosh, if a grandma doesn't have water or on the reservation or in the tribal land, she doesn't have water or electricity. That she, how does she use this box? Or she doesn't have a refrigerator to have milk or fresh milk or something like that. How's this supposed to work for
Mm,
for some of our tribal members that still live in these incredibly remote locations? And that's not to say it's not the right food, but we have to think more than, okay, we're filling a box of food. Another thing that I learned when I visited this food distribution center was that there's people that rely also on food stamps or other government resources. And I learned during one of my visits that people are now opting for food boxes And remember, you get one food box a month, which there was not much in that food box. And then but you can't have both. You can't have a food box and food stamps. So they were opting for the food box. And I'm thinking, oh my goodness, does that mean that what does that mean? What's that telling us? That our people are opting for a food box as opposed to food stamps, where they could go into a grocery store and pick their own choice of food. We have to think about that. It's like, wow, does that mean the value is obviously the simple assumption is the value is more in the box than it is in the food stamp. And so how do we try to address that? How do we try to stay on top of that possible situation as we move forward? So, it's been it's and again, this is not just an Indian country. I think that's the other thing that I keep thinking about, how many of the people in the country are impacted every single day by having to make these hard choices.
Mhm. I think that's one of the things that I keep hearing last year when we reach out to you, before I reach out to you, is a lot talking about the country can learn so much about the work that you've done, because it's so translatable to the rest of the country, um, in addressing the accessibility, the affordability. Um, you mentioned earlier about the transportation. And I think oftentimes when we think about healthcare, we think about the food that we eat, the care that we got. Oftentimes, transportation is not in our mind. Tell us more. I mean, we touched on a little bit about, getting you to dialysis. Like, how do you solve that problem?
So, I'll take it a step further than that. Housing is another problem. Whether you're looking at tribal communities, and so if you don't have a good water sewer infrastructure, you can't just build houses and assume that you're going to address those challenges as well. So it's not, again, just coming in. I think that's part of the what I hope to leave is that we have to look at this different. All need to take a step back to say, how do we now look at the healthcare of people, of our people? How do we do that in an environment where you've got housing, you've got transportation, you have food, you have remote healthcare systems? We have a healthcare system at the bottom of the Grand Canyon. The only way you can get to that facility is you either hike down or you go down, if you're lucky enough, in a helicopter, and you get to come back up in that. So we have a whole community that lives down there. So these understanding that there's complex places where our people live, where our people reside, and trying to adjust the healthcare. So looking at I would say, for the first time, one of the things that I did was I reached over, taking a whole federal government approach to health. I reached over, established relationships with Department of Housing and Urban, a Department of Transportation, and USDA, and all of these other federal entities that impact the lives of tribal country. And so I said, "Hey, what are you guys doing to help us? How can we come together and offer something better for tribal communities?" Because if you take housing, for example, and we send a person out to treatment for alcohol or substance, and if there's not a different place for them to come back to, what are we really solving?
Mhm.
How are really addressing that patient's need when we've made this huge investment to send them for, maybe 90 days of treatment, but they have nowhere else to go but to come right back into where where they left. And so looking at that and saying, what do we do? How do we address this? Actually, I learned through my meetings with Department of Transportation or Department of Housing that there are mechanisms in place. There could be mechanisms in place. So as we sort of at Indian Health Service take off just the medical lens that we look at sometimes and say, look, how do we partner with tribes? How do we make sure that tribes better understand that let's try this to see if we can do this. In addition to the housing and the water and all of these challenges that we have, in 2021, Congress appropriated $3.5 billion for water and sewer infrastructure. This is a game change for the Indian Health Service, for us to address the needs of our people in Indian country. You take just the water and sewer infrastructure challenges, and you bring that to sort of just the reality of our people, and then now we're desperately looking for engineers. So if we have housing challenges in these tribal communities where we're trying to provide healthcare, you've got to think about our workforce. Indian Health Service still has a workforce of about 15,000. So if we don't have housing, I can't bring doctors and nurses into a community to address the needs that we need to have. I'm running right now across the board 30% vacancy for healthcare professionals at Indian Health Service across the board. And I'm trying to leverage, that's really my reason for leveraging everything that I can, whether it's transportation, whether it's housing. How is it that we can meet the needs for the tribal community and then for our healthcare system to be, to provide the best care possible. So there's these things that I think that can happen, and opening those doors with my federal partners to help us make sure that we're doing a better job for our people collectively, because they're all making investments. The Department of
Mm-hmm.
Transportation makes investments to Indian country, and so how do we pull that together to make it so that health component can be part of the conversation as we move forward? Because again,
Yeah.
the transportation or the housing, making that better in tribal communities will make the health care better for our people.
Yeah. It's just like how everything is so connected
Yes.
when it talks about healthcare. I know we are short on time, and I want to uh, ask you one last question. Um, Many of our listeners are innovators. And so, as a citizen who are innovative, who are interested in solving problem, what are the things that you're looking for that innovators can support the goal and the mission of Indian Health Service?
I would say the first part of that is to truly understand what it is that we are trying to deal with. And I'm just giving you just a snippet of a picture because again, having more than 500 federally recognized tribes and understanding those uniquenesses of that tribe, their challenges and their successes, and accomplishments, understanding that first, I think is really important. And what that does is not just, it just doesn't paint a broad stroke of paint across that we're all the same, because we're not. So, and that would be the same in anything that you're trying to do, to try to improve. The second part is to, if you're looking at a specific tribal community, work with that tribe, understand what is it that they could do. Because again, I think part of the challenge that we have, from the federal government level, is we go in there and we think we have the answers to things, and we're gonna, shove it down and say that, if they just did this, we could be all better. No, it doesn't work that way. We
Hmm.
know now it doesn't work that way. So I think truly understanding and better understanding some of the challenges that we have. This past year, this past 28 months, we've dealt with some of the most horrific um, history of Indian country when we talk about the boarding school era. Boarding schools were when little children were taken from their home and relocated to a different location as we move forward. We talk about just the traumas, the traumas of Indian country, understanding the impacts of um, substance use in our tribal communities, and why it's so important that treatment facilities need to be built. However, one of the things that when you look at this, one of the privileges that I had over the past 6 months was I traveled to Iceland to learn about what that country did with regards to addressing substance use. And, they started, I believe it was 9 treatment facilities that they had for their youth. And now they have 1. And the statistics that you see them using to address the problem that they had, and in this case, it was substance use by their youth and their children. It's been amazing to think about that. And I can see these things happening in our tribal communities where, the parents, we need to re-engage the parents. We need to re-engage the schools. And if you know a little more about Iceland, the police don't carry guns. I mean, just think about that for a moment. If we could have that in parts of this country, what an amazing way that we could look at things. So there's other things that we can learn from and that we can understand, and those parts that are appropriate could be incorporated into tribal communities. It's not, again, a one size fits all and say, oh, this is how we're going to do it. It's got to be what works best for that tribal community. So understanding that part and not just assuming that, one of the things that I've also looked at is throwing resources at a problem is not always fixing the problem. To understand what is the problem, what is that core issue that we want to strive for, and then how are we going to evaluate it that we have met the goal that we have put out for us to make that community better. If you can break it down to a smaller tribal community, it totally makes sense to me that we can then work within the tribal structure to make it better. And not the government saying you need to do this, or not somebody else going in there. It's that tribal structure embracing that change that fits for their tribal community. That's what's going to work.
Thank you for sharing that insight. And I learned a lot from how the Indian Health Service work and the community that they serve. So thank you.
Thank you so much. I appreciate it.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.